Yeah, my name is Angela Dart, and I'm from Madison, Wisconsin. When I arrived here at Brio, I was diagnosed with stage 2 invasive duct carcinoma. There was a lump about the size of a lemon with questionable other spots within the same breast and within my lymph nodes. I first kind of self-discovered that I had a lump just by self-diagnosis, and it was small, and it was in early June when I found a lump. And it was one of those things where I could only feel it if I laid a certain way or was in a certain position. And then every single week, almost every single month, it was doubling in size. And so it came from June being a very small, almost unnoticeable lump, to when I arrived in early September, the lump in my right breast was about the size of a lemon. I was diagnosed on August 11th with invasive duct carcinoma. And very quickly, I, of course, went to my doctor and had all the exams, and they gave me all the protocols and what they wanted to do, and a double mastectomy and chemotherapy and radiation. And I decided very quickly that the route that they wanted me to take from the conventional standpoint was not what I wanted to take. So I did nothing and other than research to try to discover what else I could do alternatively than going the chemo and radiation and double mastectomy route. My husband and I were praying and looking through different clinics. We had been told about a few clinics in Mexico that were alternative cancer treatment facilities, although I didn't have a valid passport, and so I was like, I don't know if that's an option for me. And my father-in-law actually forwarded me an article by Dr. Mercola. That the article title was something along the lines of "My Top Cancer Recommendation in the United States." So of course that grabbed my attention because it was here in the United States. I didn't need a passport. And the article was featuring Dr. Goodyear and Brio-Medical. And when I was literally sitting in the waiting room for my MRI back in Wisconsin, reading this article about Brio, going, this is exactly what I'm looking for. And my husband and I talked about it, and he was in full support of me leaving our 6 children and leaving him back in Wisconsin and coming down here to Brio in Arizona. When I was deciding through, when you're first diagnosed with cancer, one of the hardest things is you freeze. You get overwhelmed with the decisions that are possible. Should I go conventional? Should I go completely natural? I was a part of a Facebook group called Healing Breast Cancer Naturally. And these women are wonderful women that literally just through diet and lifestyle change work to heal their breast cancer. Should I go conventional? Should I go completely natural, or should I go somewhere in between? I was really frozen. And we had a prayer team come and pray over my husband and I. And one of the things that they prayed for was just peace in decision making. And when I read the article about Brio, there was just this overwhelming piece of going like, this is exactly what I'm looking for. I'm not going to completely ignore the fact that there might be pharmaceuticals and low-dose chemos that could work for me, while at the same time I'm supporting my body and I'm supporting my immune system through vitamin C and all the other supplemental treatments that they have here at Brio. And it seemed like a perfect marriage between what conventional can offer, but also what natural medicine offers. At Brio, I received every treatment I believe that's available. I don't know that for a fact. Every day at Brio, when I walk in, I was connected to an IV, and I had a variety of IVs flowing all day long. I had infrared therapies and PEMF therapies. I received lymphatic massages, acupuncture. Every week I got into the full body hypothermia chamber, which is an experience for sure. But I said yes to every opportunity they gave me here at Brio because I put all my trust in the doctors and the nursing staff here at Brio to take care of me. You know, when we made the decision to come here to Brio, I just knew, like, I trust you guys emphatically, and I know that if they offered the treatment for me, it was for my good. And so I did everything that was available for me. I have 2 favorite treatments here at Brio. One being the localized hypothermia. The localized, so full body hypothermia is where your entire body it gets warmed up to a fever-like, flu-like symptom, and it's long, it's hot. That is difficult. There's a localized hypothermia that my body felt was, of course, a little easier. It was for like an hour, and it's a hot plate that has infrared and other therapy devices within it, and you put that on your tumor site. So for me, having breast cancer, it was like getting a warm hug for an hour, and it was really comfortable, and it was really enjoyable to sit back and enjoy the localized hypothermia. My other kind of dual favorite would be the Hocket, which is the ozone sauna. So it's kind of this spaceship kind of looking machine, and you sit in it, your head is out, and it encloses around you, but it's a sauna for your body, but using ozone. And so you get all of the sauna benefits of the warmth and the sweating and things like that, but also knowing that it's really sweating out your toxins and really killing cancer, right? That's all what we're here for. Sure, since I now am complete here at Brio, I've finished my 6 weeks, my cancer has reduced by about 1/3 in size. So when I got here, it was roughly the size, my single tumor was roughly the size of a lemon. And now it is dramatically shrunk. It's less than 2 centimeters now. And I cannot be more happy with those results. I'm leaving, I still have cancer, but it is moving in the right direction. I have an ultrasound a few days ago, and they pointed out that a large portion of the tumor that still exists is necrotic. It's dead already in the inside. So we're just, of course, praying that all that continues and moving in the right direction. For me, I think Brio is a good solution no matter what stage you are with cancer. And the reason why is it's, even for me with stage 2 and a localized tumor, I asked my doctor when they sat down, they said they'd give you the double mastectomy and the chemo and the radiation and 5 years of tamoxifen and all the things they were going to give me. I said, what would be another solution for me? Is there anything else I can do for my immune system, anything? And she told me if I didn't do this, I would be dead in a year. And that shocked me because I thought, I have stage 2, you know, I don't have cancer all over me. I'd be dead in a year, like that's my only solution. And I think Brio really offers hope no matter what stage you're in cancer. You don't have to come here as your last resort. You can come here first. You can kill your cancer here at Brio first without having to feel like you need to try conventional. You need to give chemotherapy and radiation and those mastectomies and all those things. You have to give that a try first. It's not true. You can come here first because Brio offers hope for people of all stages of cancer, and I love that about it because I don't have stage 4 cancer. I didn't have 2 weeks to live. I had maybe a year, but here at Brio, they opened the door for me and said, you're a candidate, you're welcome. And I think because I came with a strong body and because I came with a strong immune system already, that really helped me sail through a lot of things here at Brio that maybe if my body was weaker, it would be more difficult. Brio, just because it's a natural therapy does not mean that every day is super easy and it's a spa here. It smells like a spa and it looks like a spa, but the days are difficult and it still takes a toll on your body even when you're strong. So I'm really glad that I came here immediately and didn't weaken my body with conventional therapies. I came here strong and I'm leaving strong. When you're a cancer patient, it is, no matter, again, whatever stage you're in, when I got diagnosed, I had 0 symptoms other than the lump. I didn't feel sick, I didn't feel weak. And so it took a while for me to, I guess, understand and realize that this is something that is really life-threatening and something that's really serious, because for my physical body, I didn't feel like that. And so one of the beautiful things that I can't thank you enough, staff at Brio, is, we come here broken as patients, to be honest with you. And we come here in a stage where we don't know which way is up and down and right and left, and to be greeted with warmth and love and like every single staff member at Brio, I can tell cares. And I'm not just another person that's pushed through the system, but I'm Angela, and you know that. You know my name, and I know your name, and we share stories about our kids, and those are things that, as I'm here without family, truly fills my heart. And let me have an extended family here with you as staff members, and also my caregivers. And I couldn't ask for a better team and a better place to be. And for future patients, I just want to say to have faith in the staff and have faith in that they know what they're doing, because they do, and they'll walk through this with you. I've never ever in my life had medical staff pray with me. And on different occasions here at Brio, I had staff step aside and hold my hand and pray to our dear sweet Lord for healing and guidance and coverage and care. And so I just thank you for loving me and letting me journey this with you.